So, conjunctivitis. As previously we discussed the different classification of conjunctivitis. Now in this classification, first of all, we will discuss bacterial conjunctivitis and its different subtypes. Okay. So first of all, the bacterial conjunctivitis is mainly of three types. It is mucopurulent conjunctivitis, purulent conjunctivitis, and membranous conjunctivitis. We will discuss each one of them with clinical features, treatment, and diagnosis. Okay. So the first one is the mucopurulent conjunctivitis. The mucopurulent conjunctivitis is also called acute bacterial conjunctivitis. It is the conjunctivitis and which is characterized by the acute redness and mucopurulent discharge. Okay, so when there is the onset of redness and mucopurulent discharge acutely, this is called mucopurulent type of conjunctivitis. The etiology is that most type of bacteria, most of the common bacteria, they are causing this type of conjunctivitis. For example, we have the streptococcus, staphylococcus, Haemophilus influenzae, Moraxella liconata, Proteus, Klebsiella, etc. So these all common bacteria, these can cause this type of acute bacterial conjunctivitis. Okay. The clinical features are that the patient will present with redness and mucopurulent discharge, and these symptoms will be presented acutely. Okay. When he will complain that when he wakes up early in the morning, his eyelids and eyelashes, they are stick together, and the eyes are difficult to open. Okay, so he will complain these. Now when we look to the patient, what will happen? There will be mucopurulent discharge in the eye. Okay, mucopurulent discharge will be present in the eye. Maybe the discharge will stick on the eyelids and on the eyelashes. Okay, and these all symptoms, the patient will present these all symptoms acutely. Now, how can we diagnose? Diagnosis is mainly clinical, and there is no requirement and need of the laboratory investigation. So mostly the diagnosis is clinical. Now the treatment is, first of all, we will irrigate the eye. Okay, we will irrigate the eye and we will remove the debris and crust, etc. from the eyelashes and the eyes. And then after that we will prescribe topical antibiotics. For example, gentamicin, tobramycin, moxifloxacin, ciprofloxacin, ofloxacin. So we will prescribe him the topical antibiotic drops in ointments. Okay, the drops will be given at daytime and the ointments will be applied at night. And most of the 60% cases of the mucopurulent conjunctivitis, it resolved without any treatment. So it is not so severe and dangerous. It can resolve without any treatment. The next one is the purulent conjunctivitis. This is also called gonococcal conjunctivitis. Okay, the patient will present with severe onset of redness and thick, creamy, profuse discharge, and these symptoms can present in couple of hours. Okay, after exposure to the causative agent. The etiology, it is caused by Neisseria gonorrhea. Okay, so that's why it is also called gonococcal conjunctivitis. It is presented mainly in two groups. Okay, in adults and in children. And adults and in children, and adults, it is because the source of infection is genitourinary. So in adults, when they touch their genitalia and then again finger his eye or her eye, so it will transmit the Neisseria gonorrhea from genitalia to the eyes. And in children, it is transmitted from the birth canal of the mother during delivery. So it mainly, purulent conjunctivitis is mainly encountered in these two groups, in adults and in children. Okay, the clinical features are that the patient will present with severe redness. There will be thick, creamy and profuse discharge from the eye. Okay, the ocular edema. So there will be the periocular edema. The lid margin will be edematous. There will be the periocular, the surrounding areas will be edematous. Okay, the case is severe. There will be, when we investigate, the patient will have a genitourinary tract infection if it is adult. And in children, we know that it will be a child, okay? So, chemosis, what is chemosis? The chemosis will be present in purulent conjunctivitis. Chemosis is when the conjunctiva is edematous. So, the edema of the conjunctiva is called chemosis. There will be chemosis. And another thing, the preocular lymph node will be edematous. So these are the auricular lymph nodes, okay? So the preauricular lymph nodes will be edematous and their separation can also occur, okay? So chemosis, preauricular lymph adenopathy, okay? And the last one is when the condition is untreated or if it is ignored, what will happen? The corneal ulceration can occur. When the cornea is ulcerated, then it can be followed by iritis and iridocyclitis and eventually blindness. So the case can be complicated if it is left untreated. Okay, the diagnosis is, we can diagnose the condition from the clinical picture, as there will be the severe redness, the purulent discharge, periocular edema, or lid margin will be edematous. There will be the chemosis, preauricular lymph adenopathy. So from the clinical picture we can diagnose the condition, and also the patient will have genitourinary tract infection. So it will give us the clue that it is purulent conjunctivitis. And we will take the swab from the discharge and we can send it for the culture and staining and sensitivity. Okay. The treatment option, first of all, the case is severe. So we will admit the patient. The patient will be admitted to the hospital immediately. Okay. And we will take the conjunctival swab for culture and sensitivity and staining to diagnose that it is actually the nasally gonorrhea. Okay, so admit the patient, take the swab from the secretion and debris. Next, irrigate the eye. Irrigate the eye, remove the debris from the eye and eyelids. Okay, after this we will introduce topical antibiotics and systemic antibiotics. Topical gentamicin, tobramycin, ciprofloxacin, ofloxacin, moxifloxacin. So these topical antibiotics will be introduced if the case is severe. So we will also give systemic antibiotics. And systemic antibiotic, for example, tetracycline, doxycycline, erythromycin, azithromycin. Okay. So this is about the purulent conjunctivitis, which is also called gonococcal conjunctivitis. Okay. Now, membranous conjunctivitis. Membranous, it is the conjunctivitis which is characterized by the redness of the eye and the formation of a true membrane. So there will be the formation of true membrane on the conjunctiva. Okay, mainly on the palpebral and fornical conjunctiva. There will be the formation of a true membrane, and these symptoms will present acutely. So when a patient presents with us with the acute redness and the formation of a membrane, we call it membranous conjunctivitis. Okay, it is caused by a bacteria which is Corynebacterium diphtheriae. Okay, and it is they are saying that it is a rare cause of conjunctivitis nowadays because of the antitoxin of diphtheria. Pathogenesis is that when there is the Corynebacterium diphtheriae in the conjunctiva, there will be a violent inflammation. Okay, there will be a violent inflammation in the conjunctiva, and this violent inflammation will cause there will be the fibrinous exudate. So the infiltrate will come into the conjunctiva and on the substance of the conjunctiva, on the surface of the conjunctiva. So due to the violent inflammation, the fibrinous exudate will come on the surface and in the substance of the conjunctiva, and it will form a true membrane. Okay, and the membrane will mostly be formed on the palpebral conjunctiva and fornical conjunctiva, and it is it is not forming on the bulbar conjunctiva, okay? So the bulbar conjunctiva will be spared. The bulbar conjunctiva will be spared, and this violent inflammation of fibrinous exudate will form a true membrane. Why it is called a true membrane? Why? This is called true membrane because when we try to peel off the membrane, when we try to remove the membrane, it will cause bleeding. So that's why this is called a true membrane. Okay? So this is the pathogenesis, that how the formation of true membrane occurs. Because of the violent inflammation, there will be the fibrinous exudate on the surface of the conjunctiva and in the substance of the conjunctiva. So it will form a true membrane. By removing this membrane, it will cause bleeding. This is the pathogenesis of the membranous conjunctivitis. The clinical features are, there will be the redness, there will be the membrane on the conjunctiva, and this will be the true membrane. When we try to peel off, it will cause bleeding. Okay? So, and this is why this is the bleeding, it causes bleeding, that's why it is called true membrane. In contrast to the zoodomembrane, the zoodomembrane is that one which is caused by the coagulative exudate. So when there is the inflammation and there is the accumulation of coagulative exudate, this coagulative exudate will cause zoodomembrane. By removing this membrane, it does not cause bleeding. That's why it is called zoodomembrane, in contrast to the true membrane which causes bleeding. Okay? And there will be also the pre-auricular lymph nodes will also be involved, and there will be lymph adenopathy in the pre-auricular lymph nodes. The complication, if we doesn't manage the condition timely, what will happen? It can cause different types of complication. For example, symblepron. Symblepron is when there is the bulbar conjunctiva, the bulbar conjunctiva and the palpebral conjunctiva will stick together. Okay, when they stick together, okay, like this, it is called symblepron. Encyloblepron is when the two eyelids, when the two eyelids stick together, this is called encyloblepron. So it can also cause this complication. Symblepron, encyloblepron. So that's why due to the true membrane and the inflammation, it can cause cicatrization. So that's why it can cause entropion, trichiasis. Because of the cicatrization, it can also destroy the different types of glands in the conjunctiva. So that's why it will cause the dry eye syndrome. So symblepron, encyloblepron, trichiasis, entropion, dry eye syndrome. So these all are the complications of the membranous type of conjunctivitis. Okay. Now the treatment, how can we diagnose the condition? The condition can be diagnosed from the clinical picture and from the rising titer of immunoglobulin. So there, when we take the serum level, there will be the rising titer of antibodies against the Corynebacterium diphtheriae. We can also do PCR and culture and staining. So these all will give us a clue that whether it is Corynebacterium conjunctivitis or not. Okay. The treatment options, we can treat the condition. Remember one important thing, that every case of the membranous type of conjunctivitis should be treated like Corynebacterium conjunctivitis. Okay, whether it is before the investigation, if it is not confirmed, and if we see there is the membrane on the conjunctiva, we will treat like the Corynebacterium type of conjunctivitis. Okay. So every case of the membranous conjunctivitis should be treated like diphtheric, that it is diphtheric conjunctivitis which has caused the membrane formation. Okay. Now, then we will irrigate. First of all, we will irrigate and remove the debris. So the debris, the discharge, the discharge. One important thing is now, the discharge is, this is the bacterial type of conjunctivitis, but the discharge is serous. Okay. It is the only bacterial type of conjunctivitis in which the discharge is serous. So we will remove First of all, we will irrigate the eye, we will remove the debris and discharge from the eye. Then we will get topical and systemic antibiotics, and the most important thing is I told you that every case of diphtheric membranous conjunctivitis should be treated like diphtheric conjunctivitis, and we will get diphtheric antitoxin in the dose of 4 to 10,000 units. Okay, so this was about the bacterial type of conjunctivitis. We discussed the mucopurulent type of conjunctivitis, purulent conjunctivitis, and membranous conjunctivitis.